Hello Professor and classmates, I am Zhou Hao, and today I will be discussing about Koro, a culture-bound syndrome found in many countries. So, first things first, this syndrome occurs worldwide and a mass hysteria of genital shrinkage anxiety, and this culture-bound syndrome has a history in Africa, Asia, and Europe. In the United States and Europe, the syndrome is commonly called as genital retraction syndrome. And this Koro syndrome can also be diagnosed through psychological assessment along with physical examination to rule out genuine disorders of the genitalia that could be causing through retraction. And this syndrome is from the Malay word called Koro, which means the head of a turtle. So it's like the genitals behave as the same way as the head of the turtle, which can retract inside to its shell. And these are some of the symptoms that Koro patients might have, and which is the genital retraction due to cold temperature. This is very common throughout very many males, but for Koro diagnosed patients, this could last for several hours, up to 2 days, and the patient will obviously feel that genitals have shortened, and because of this they will have an anxiety attack, and as you can see, it's like the fear of death or penile dissolution, which means that it will be shortened because of the retraction and loss of sexual power. And because of this, the patients could perform injury-inducing actions, and some of which is like for the males, they will clamp their penises in order for it to not retract, and it's like anchoring the penis so that it won't go back in. And for the women, they will insert an iron nipple to their nipples so that their nipple will not retract. And here are some of the causes for Koro-like syndrome. Psychosexual conflicts, which mean their interest in their sexual life, personality factors, cultural beliefs, and for the non-Chinese victims is like significant factors which are premorbid sex inadequacy, which means they are unable to perform sexual activities, sexual promiscuity, which means sex with many partners, guilt over masturbation, and impotence. And here are some of the examples of how we could diagnose patients with Koro. And for the primary criteria is, of course, the patient's report of their genital being retracting despite the lack of objective physical evidence that could show that it is actually retracting, and it is followed by severe anxiety. And researchers has also identified Koro as a possible cultural relative of body dysmorphic disorder, which mean like they are dissatisfied with their own body. And all of this is not an important factor to diagnose Koro. It's just some of the example.
Hi everybody, my name is Chen Minghua, and I will start where Zhou Zihao ends. And now we are going to discuss about the physical examination. First of all, the genital examination will happen immediately after the penile exposure to avoid changes due to external temperature. So for example, if we're in a room that has a lower or colder temperature, it could affect the penile size also. So it is best to examine immediately after the penile is exposed. In order to exclude genuine panel anomalies such as hypospadias, hypospadias is the urethra does not open from its usual location, and then epispadias, rare type of malformation in which the urethra ends, and Peyronie disease, abnormal curvature of the penis. So, physical examination should note any injuries inflicted by the patient in an effort to prevent retraction as further confirmation of Koro. For example, because usually people, when they notice that their genitals are retracting, they will do some dangerous act to prevent them. So it is best to note any injuries happens before the examination happens. And then moving on. And now for the next part is the treatment part. So basically the treatment part will be separated into two treatment methods. The first method is the science-based treatment. It is widely known as the modern method treatment. The first, of course, the most basic will be psychotherapy, because a lot of these cases are culture-bound cases. So the first step will be psychotherapy. And then the second method will be searching for underlying sexual conflict or psychotherapeutic. This method is usually done in the Western. It's more like Western method, because there's a lot of maybe like couples or sexual partners that have conflict, or maybe like underlying some conflict background, which leads to this culture-bound syndrome. The next treatment is the indigenous treatment, or mainly known as the traditional method. This is more like to the eastern part, so it's like Asia and maybe Southeast Asia. A lot of them, for example in China, traditional treatment based on the cause suggested by cultural belief are administered to the patient. For example, like praying to their gods, asking Taoist priests to perform exorcism is very common in China. And there's another like story that if a fox spirit is believed to be involved, people may hit gongs or beat the person to drive it out. It's some like it's like an exorcism things. And then the person will receive a yang or yin augmenting Chinese medicine potion, usually including herbs, pylos antlers, stack of deer or deer tail, and tiger penis, deer penis, and fursuit penis. Other foods for therapy are pepper soup, ginger soup, and liquor. So, as you guys can see in the picture below, there are fur seal and then tiger penis and also deer penis inside the jar. Yeah. So basically, these are the more common China traditional treatment method towards this culture-bound syndrome. And then these are some of the list of the countries that are affected by Koro. So majorly, the more big part are China, of course, Southeast Asia, including Malaysia, Singapore, Indonesia, Philippines, and Thailand, and other neighboring countries, and then like the big Africa continent, and then some part of the US and Europe. The Europe part maybe is like more toward Eastern Europe, because Eastern Europe and Asia has a lot of things in common, like background, history, and other things. Yeah. So our presentation ends here. Thank you.